Hello friends and my dear students. So today we are going to discuss about the beta blockers. So beta blockers are generally three types: non-selective beta blockers, beta 1 selective and beta 2 selective. And the beta 2 blocker have no clinical utility. The name of the drug is butoxamine. Since butoxamine is of no such clinical utility, so we will not discuss the beta 2 blocker more now. So non-selective beta blockers, that is they block both beta 1 and beta 2, while the beta 1 selective means they block only the beta 1 receptors. And we already know the beta 1 receptors are mainly present in the heart. The common properties between the non-selective beta blocker and beta 1 blocker is that they both block the beta 1 receptor. It means they can be used in the cardiac conditions like hypertension, angina, chronic congestive heart failure like myocardial infarction, arrhythmia. But the non-selective beta blockers can be used in a condition outside the heart because they block beta 2 receptors also. And we know beta 2 receptors are mainly present in the bronchi, blood vessels and liver. And in bronchi they cause bronchodilation. In blood vessels they also causes vasodilation. And in liver they reverse the condition of hypoglycemia like in diabetic mellitus. So if we block the beta 2 receptors, then bronchoconstriction occur, then vasoconstriction occur, and the condition of hypoglycemia will not be reversed. So the non-selective beta 2 blockers cannot be used in a condition like asthma because they will worsen the condition of asthma. They can also not use in the peripheral vascular disease. They can also not use in the diabetic mellitus. So we can say the non-selective beta blockers can be used in the condition where beta 1 blocker can be used, or they can be used in a condition like glaucoma, migraine, anxiety, thyrotoxicosis. So we can say in the cardiac conditions like hypertension, angina, chronic congestive heart failure, myocardial infarction, arrhythmia, both non-selective beta blocker and beta 1 selective blocker can be used, while in the conditions like glaucoma, migraine, anxiety and thyrotoxicosis, only non-selective beta blockers can be used. But the non-selective beta blockers are contraindicated in these three conditions like asthma, peripheral vascular disease and diabetic mellitus. So in these three conditions, so the patients who having the problem of hypertension along with the asthma or peripheral vascular disease or diabetic mellitus, in these cases non-selective beta blockers cannot be used. Here the safer drugs are beta 1 selective blockers are used. Now let's see the classifications of non-selective beta blocker and beta 1 selective. And the classification is also as per the generation who is developed first, that is first generation, second generation and third generation. So if we see the classification of beta blockers are mainly divided into the two categories, that is non-selective beta blocker and beta 1 selective, or can say cardioselective blockers. Non-selective means they block both beta 1 and beta 2. In this non-selective beta blocker, additional category is that which blocks the alpha receptors also, that is alpha plus beta blocking activity. So the drugs included under the non-selective beta blocker which block both beta 1 and beta 2 are propranolol, sotalol, timolol and pindolol. And the drug with additional alpha blocking activity includes labetalol and carvedilol. Now the beta 1 or cardioselective blockers, it includes 8 drugs. They can be learned with the mnemonics new, beta, blocker, act, exclusively at myocardium. As the name itself indicates, these are the new beta blocker and which act exclusively on the myocardium. So new, NE, nebivolol, BE, betaxolol, B, bisoprolol, AC, acebutolol, E, esmolol, AT, atenolol, M, metoprolol, C, celiprolol. Most importantly, beta blockers can be learned by the ending with the lol. All the beta blockers have their ending with the lol, and beta 1 blocker can be learned with this mnemonic. New beta blockers act exclusively at myocardium. N means nebivolol, B, betaxolol, B, bisoprolol, AC, acebutolol, E, esmolol, AT, atenolol, M, metoprolol, and C, celiprolol. And except these 8 drugs, all the other beta blockers come under the category of non-selective beta blockers. So this is the general classification of beta blockers. Beta blockers are further classified as per their generation, like first generation, second generation, and third generation. Now let's see this classification of beta blockers. So the drugs come under the first generations are older and they are generally the non-selective. So these old non-selective drugs included propranolol, sotalol, timolol, and pindolol. And the second generation drugs are beta 1 selective. They develop after the first generation, and the drugs come under this category are the few of the beta 1 selective drugs which we have already studied, include metoprolol, atenolol, acebutolol, esmolol, and bisoprolol. These 5 drugs which are beta 1 selective are the second generation drug. Now the third generation that comes after the second generation, they also have alpha blocking property or vasodilator property. The examples of these categories are both labetalol and carvedilol. As we know, these also have alpha blocking property. And the remaining drugs of beta 1 selective like nebivolol, betaxolol, and celiprolol. These are the third generation. So this is the classification as per the generation, that is the first generation, second generation, and third generation. First generation drugs are the only non-selective drugs. Second generation are only the beta 1 selective, and the third generation category drugs also have additional alpha blocking property or vasodilator property. The drugs included are labetalol, carvedilol, nebivolol, betaxolol, and celiprolol. So what is the meaning of intrinsic say pathomimetic activity? That is the drug which have partial agonistic activity. That is drug neither fully activate the receptor, neither fully block the receptors. So we can remember the drug under this category contain partial agonist activity. So here C stand for celiprolol, P for pindolol, A for alpranolol, and A for acebutolol. So these are the drugs which have partial agonistic action. Now the membrane stabilizing activity. These drugs are also known as sodium channel blocker, or can say also have local anesthetic activity. Since their drugs causes local anesthesia, cannot be used in the case of glaucoma but are effective in arrhythmia. So drugs under this category can be remembered as possess membrane stabilizing activity or local anesthetic property. So here P stand for propranolol, M for metoprolol, L for labetalol, A for acebutolol, and P for pindolol. So these are the drugs which have membrane stabilizing property. So these are the drugs which can be used in arrhythmia but not in glaucoma. So these are the beta blocker with intrinsic sympathomimetic activity. These are the beta blockers with membrane stabilizing activity. So it is all about the beta blockers classification, especially non-selective beta blockers, beta 1 selective blockers, first generation, second generation and third generation, beta blockers with intrinsic sympathomimetic activity and beta blockers with membrane stabilizing activity. I hope you understand the lecture very well. Thank you so much.